Thank you. Today we have with us Dr. SHELLY SHARMA, PhD, MD, PhD, Diploma in IACS Greece. Have done advanced homeopathy course in Greece, studied psychiatry and done fellowship in psychiatry and counseling, practicing since 2011. Has successfully treated wide variety of patients from children to elderly. Running 2 clinics. As a researcher, Dr. SHELLY SHARMA has publishing and presenting her scientific papers nationally as well as internationally, Dubai, Germany, Italy, and more. Has awarded Best Case Presentation Liga 2019, invited radio channels to educate people about benefit of homeopathy, ex-associate professor, physiology department, invited as key speaker to many colleges, conduct educative webinars for students and doctors nationally and internationally, conduct many health awareness camps, talks for patients. All indicates that she is a real professional, and the topic is Materia Medica Pediatrics Part 4, Scope of Homeopathy in Acute Emergency Pediatric Conditions. On behalf of Ifph, I welcome Dr. SHELLY SHARMA. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you very much, Dr. Danish. And I'm very glad to be again here. And I hope I'm audible. My voice is clear.
Course. Yeah.
So we'll start with our today's session on pediatrics. First, I'll share the slide with you all. Just give me a minute. Can you see my slide?
Yes, of course. Good.
Okay. Hello. First of all, I'm really happy to see the way you all are growing and you're doing a great service for homeopathy. Trust me. I mean, I can tell a rubric for International Forum of Classical Homeopathy, which is perseverance. Being persistent. It's very rarely seen in groups who are very persistent. There's a lot of perseverance. So, आज एक rubric आप सबको पता चल गया. Being persistent and perseverance is International Forum, right? So today my topic will be pediatric materia medica. So as we go ahead, thank you to Dr. Samuel Hahnemann for such a lovely science, my teachers, my gurus, who have motivated me a lot and taught me a lot of classical homeopathy, and here what I am for you all. Most of the time, I've been asked like what I have to do in order to master pediatrics. Unfortunately, pediatric practice is very specific. Unfortunately, the pediatric practice is very superficial. And, we spoil a lot of cases with pediatrics. We end up suppressing a lot of pediatric cases. Because what people usually say, what doctors or students feel is it's very difficult to extract a case from a pediatric child. If you will be depending on the parents, for every parent, the child is like a Krishna or a world's most lovable child, right? So this confuses every doctor. So in today's webinar, I will not be teaching you any materia medica, but I will be giving you a way, like how you have to study a materia medica on pediatrics. 1, how you should be approaching a case of pediatrics. 2, now what you have to do in order to master pediatrics. First and foremost thing which I do in my practice is being very unprejudiced. And actually, you have to be very unprejudiced. What do you mean by unprejudiced? Whenever a case comes of cough or whenever a case comes of tonsils, usually we have it in our mind, so let us give it belladonna. Or a case of cough, let us give ipecac. We are prejudiced at the level of prescription. So whenever a child comes who is shy, who is weeping, we end up giving pulsatilla, but we don't think of another remedies like medorinum. Do you know medorinum child is one of the most weeping child in a materia medica. He cannot give you any symptom without weeping. Plantain fruit, one of the most weeping remedies of a weeping child. Viola orodata, one of the most weeping children we have in materia medica. So we are prejudiced what we get. Third, we are satisfied what parents do say. This again makes us prejudiced. So what you have to do whenever you're treating pediatrics is have sound senses. The moment child enters the clinic, just observe the child, how the child is sitting, what the child is talking. So today, before joining you, I had a new case. The case was about, it was again a case of autism, where the girl was clinging to her mother. She was not leaving her mother. She was so attached, So the whole case I took, and it was actually looking like a case of falsitilla because she was clinging to her mother. She cannot stay without her mother even for 1 hour. She was a weeping child. But when I went deeper into the case, I understood her sensitivity. So she is a very introvert child, Why do we consider just a rubric clinging to her mother when she doesn't leave the mother? Why are we not thinking in a way that this child needs a one-to-one deep relationship like natural, right? Or this child is so sensitive to open up with outside people because this child has a fear of getting hurt. Again, this child was very curious. Though it's an autistic child, she was asking a lot of questions, etc., etc. We will end up giving a remedy which is like, we'll just end up into curious rubric. We may give higher scammers, etc. But we fail to understand why the child is doing this. And when you go deeper into your cases and understand why you have to just dissect the case, and then this will help you. And I gave this child remedy natural self. Though she was very clinging to her mother, though she was very sensitive, she cannot leave her mother for a second. Whenever she's sick, she wants her mother just to be around her. But she will cooperate with the nurses. She will cooperate with the doctors in the hospital. So this is kind of thinking you will have to develop when you have to actually treat pediatrics at pathological level, right? Don't rely on parents. Again, logical thinking is very important when you treat pediatric cases. You cannot just get whatever information you get, you cannot just prescribe on that. Lॉजिकल थिंकिंग डेवलप कीजिए, चाइल्ड की साइकोलॉजी को समझिए what is the need of the child, try to understand what every child wants. Some children want love, some children want affection, some children want respect. So I remember a case of mine where this little girl, she was having kidney stone. She was her stone was 2 centimeters, and she has been operated 6 times. She was 8-year-old child. So the whole case I took, and what thrust I got from the child was, she wants lot of importance in her family. She wants lot of importance between her friends in the school. And whenever she is not the center, she is not getting that importance, she will just leave that group. Of course, by eliminating many other rubrics, taking a totality, I gave the remedy.
Excuse me, Dr. Shelly, the slides are not moving, I think.
Yeah, I'm just on the same slide.
Okay.
Yes. Right. So I gave the remedy Calcaria sulf to this patient, and 2 centimeter stone. Within 5 days, it fell off from her urethra. So this is the magic of having a logical thinking in your case. Understand child psychology and read a lot of books. So let us go to the case. Okay. This is a case of autism spectrum disorder. So this child was, when this child was 1 year old, suddenly she developed dribbling of saliva with repeated respiratory issues. She was absolutely okay till she was 1 year of age. Her developed milestones became delayed. Her walking was delayed. Her speech, she did not develop speech till she came to my clinic. Her understanding, her grasping was very slow. She became non-communicative suddenly. She was not having any eye contact with anyone. Gradually, she developed a lot of irritability on little things, and her complete focus was just watching television or mobile phone. So her human touch came down drastically. She was not getting mixed up with people. She was not communicating with outsiders much. She was just involved with mobile phone or television. There was no speech. So What is the nature of the child? So this child, when she entered my clinic, I could observe that she was constantly moving about in my clinic. So again, whenever you treat mentally, physically challenged children, especially mentally challenged children, what you observe is more important than what information you get. Start observing these children. Develop the knack of observation. So this child, when she entered, like I was sitting on my chair, her parents were sitting that side. She was just, going around in my whole clinic. She was going out of my cabin. She was going from one room to another. She was just as if she's in search of something. So this was a very characteristic observation for me, right? So she was moving about with her gestures and movements as if she was searching something. So if the child is just moving about, it's very important to observe what are the facial expressions of the child. If she is lactose, she will also move about in your clinic, but there will be a lot of suspiciousness. Why she will move about? Because she has to be very sure there is no threat outside, because lactose is a snake. Whenever the snake comes out of its bill, he is very gradually coming out, taking note of the environment so that there is no danger around it, and then he will go fast. But there was no suspiciousness. There was no fear. I could just see as if she's a tourist. She's just saying, what is this? What is that? This vase, this television. She was just as if she was searching and she was wandering. Basically, she's a very angry child. And whenever her parents say no, she will just strike things or break things. She always desires company, but she doesn't mix up with people. She wants someone with her, but she will never talk to them. Now, what is the disposition of the child? The child otherwise is a very mild. Her mother said she's a very mild child. She's a very cute child, very lovable. So, whenever again a patient comes to your clinic, it is very important to see what energy you get from the child, right? Some children will, when you want to sympathize with them. Children, you want like, even I want to see, every child is your vibe. You have to catch good from your. When I at this looking at the child, she was a cute child. Very so smile, but if anyone contradicts with her or don't, she'll become angry. At 20, she is so smart that my mother's, this is my favorite, this is my favorite, and if they listen to her, she will pick that up. She will just kick off the floor, she will break things, and she will throw a lot of tantrums. You get till you get everything. She dances with children, and she doesn't really watch the school. So, now, child is he's and picks up autism order instead of every different cat school. He's he has saliva with a dribbling mouth in a and he constantly puts his fist come out and they bite. So here, this is like the way in such a case. So the child mentally challenged. Now your mother's pregnancy history. Right? So her mother said that she got married after she joined family. She was pregnant after 2. Her mother always used to compare with her sister. Every time she was being compared, this mystical and love. She couldn't find happiness in of her, you know, enjoy my happiness. I didn't want. I couldn't find my husband thinking to do this, to do that. But I think no one was happy than the very restless throughout this. And I had things, but I started saying, I didn't did that anymore, or I didn't have time for ice cream. So once I started eating, I took two bowls of ice cream. This happened because of pregnancy. It was very
Excuse me, doctor, your voice is not clear.
not now.
Some
Now it is
often breaking. What? Maybe due to network problem.
okay. Is it clear now?
I think due to weak network, that is a problem. Not from your part, I think. Now, still not clear. Not audible now. Now, no volume. Some problem somewhere, I don't know. Happened. Not audible, doctor. Not audible. You are now muted, I think. Please unmute. Please unmute. Yeah.
Am I audible?
Yes.
Okay, fine. So what were the observations made in this case? Okay. So here comes the part of observation, right? Okay. So what were the observations made in this patient? One is she was very restless child in my clinic, just going from one room to another. When I saw her, she had very delicate features. Her nose was very sharp and delicate. Her hair was very fine, light brown color. Her eyelashes were very long and they were very beautiful. So I could see sharpness and beauty in this face. Her parents say that she is enjoying whenever they go out of the house, and she always demands that she wants to go out, play out, go on a drive, etc. In the clinic also, she was not sitting in one place, constantly telling her father to take out of the room. Okay, so let us see the follow-up once I gave the remedy after 8 months. So I want you to observe this child. Look at her features, look at her hair, look at her body language. This is a follow-up after 8 months where the parent is telling that when I came here, she was not talking, her IQ was very low, but now she's grasping things very well. She's able to read things. She's able to recite the whole poetry. She's getting quite less frequent as compared to before. Just observe the child. This is the remedy. I want you all to observe and comment with the remedy.
Yes, doctor, please proceed.
So,
Dr. Shelly, am I audible?
yeah. Yes, tell me.
Yes, you can proceed.
Yes. So here you see the child. This is a follow-up after 8 months, and now the parent is telling that my child is first. My child didn't knew what she wants to eat. Now she knows what she wants to eat. So here when you treat a person with autism, you shouldn't aim just you know decreasing the symptoms. You have to make her more human-like. This has to be your aim, right? So let us see and proceed with the case again. Analysis of the case. So if you have anything about the remedy, just share with me. So I'll tell you my analysis. What remedies do you think in this case? Any idea about the remedy? So I'll share you my analysis for the case. So here, what I analyzed in this case was one, the child was wandering. He was just going about in the whole consultation. The child was very restless, very discontent, lot of anger tantrums, desire to travel, very delicate child, very energetic, and mother had a strong history of discontentment. The remedy was very simple, and I gave the remedy tuberculinum 1 dose, right? And in the span of 8 months, there was a huge difference in her IQ level. Her speech improved, her eye contact improved, her reading improved. I just had to repeat once the remedy tuberculinum in the 8 months period. She's still under my treatment, still improving. But I just want to show you all how you have to approach such kind of cases, what mindset you have to have, and what is the path you have to follow, which is hand in hand path. Now let us understand the remedy tuberculinum. So whenever you see this remedy, just by looking at this remedy or looking at this patient, you can understand this remedy. So the remedy tuberculinum, these people are usually very light complexion people, right? In India, we don't have much of blue-eyed people, but they will have lighter eye shades. Every remedy carries its own beauty. This is the beauty what tuberculinum will carry. They will have, even it is an adult or a child, they will always have fine hair, beautiful fine hair. They will be usually very thin people, slim people, stooped shoulders, fat chest, because these people burn up much like sulfur. They have a very high BMR. They eat well. Though they're eating well, these children will lose weight. They will not gain muscle mass. So they have very fine eyelashes. You go into the repertory, see the rubric, fine eyelashes, long eyelashes. You have remedy tuberculinum. Fine dark hairs grow along the spine. This is a very confirmatory symptom. If you see the child, any child who has a fine hair growing along the spine, the remedy is tuberculinum. If you see fine hairs, thick hairs on the skin, think of the remedy medurinum and thuja and thyroidinum. Never these prescriptions will fail. Usually these children have a lot of flattering and seductive behavior. Whenever they will come to your clinic, they will be well dressed. They will have a very, what I say is, very seducing behavior. Like they'll talk in a very seducing way because somewhere they are very sentimental and romantic people, right? Very flattering to me. Now, three main characters of this remedy at physical level. If you have these three things in your patient, whatever the disease is, think about them. Number one, like pulsatilla, there is a great changeability of symptoms. Today he has pain here. The very next day he will have pain here. The very next day he will have pain in the knee. Today he will have throbbing pain. Tomorrow he will have drawing pain. So the word used for this is rapid kaleidoscopic transformation. Like suddenly a color red becomes blue. Like there's a sudden change. I mean, you also still wonder. And she was saying she has this kind of change, sudden change. Think about don't just about pulsatilla. Second, these children, despite of taking course, parents not restriction, do not give them access. They will take extreme care at school. And they'll also say, doctor, I don't need a lot of care for my child. That you are good off, is off. My child catches cold. Not from where my child is cold. Raise with the cold. The mother will say, doctor, so still weak and the symptoms complain suddenly like so whenever you have this four symptoms coming together, don't give them tuberculinum. Think whatever pathologist have.
Doctor,
Okay.
Doctor, kindly restart the screen sharing. This is not visible now. Screen is not visible now. Yes. Okay.
So the other thing is and this is the mind of the session. We all what we understood about tuberculinum where lot of circumstances, my child on so they are very supportive, like suppose do an extra, they will solve children are physically from them. And children tend to more mechanical things because they will oh why enjoy or with two-step games. So just what we know, see income. Mama, mama said, mama said like this, my friend said like this. And the schools should them, pet of my child. So love is good looking, very less. They will not get they go to school when they will complete school. He fight another thing. They without any reason. They have now we have to understand why this is because satisfied your Vishnu or the what they are snapping. What makes it who snap is taciturn. Remedies like food, right? Mila, where the difference between these remedies you have to understand when you study. Fine. So because what difference what difference what we will understand this bring whenever you want physical will, mental will, complementary. The difference the shifting from one organ to another. These children like one and the medication I want to try go out. Let us December, let us go out. They just want to go out and have a good quality. They just change very so these children they will settle up the thing which will want to do many YouTubers who keep different things, who are stuck up one route. They need this is not teach them, you know, think that's critical. Now, I want to wonder question. Traveling around the 3-1. Amra also wants traveling. Tuberculum also wants traveling. What's the difference between Ignatia traveling, area fossa, and tuberculum? Now, for wants to travel, sit out area element. Again, Calcarea for this spot when they have to go to new places. Now, second, Ignatia. So traveling actually ameliorates mentally. And children the same he has to go and go to Greece instead of Greece. Why? He will take time. Chota hai, bahut badi hai. With the world. How can he go? You know, the parents always saying it. Oh, the child is so interested. No, why don't you put your child into drawing or in sports? So, doctor, what I tell you, one child will go and learn badminton. Goes, next he tell him the thing, cricket. He gets bored. He joins. He gets bored in 1 to 2. He is not shifting his hobby. This is again an indication of and this symptom of a lot of things related to tuberculosis. Keep on shifting their hobby. They will keep on changing teachers. Why they want us is because there is inner discontent. This is a remedy where there's no they compose content and someone is discontent, you should search that inside you. Your journey has to be a spiritual journey towards Christendom. They find contentment in the world. Never get it because this true happiness comes when you just and this is a life lesson they have to be what they have because they never had what they have. Fulfillment and change, but they never. It's like a candle burning from both ends. They're just that, but happy with this. We keep on. This is the main reason this angry for being such a love child. These are not fulfilled. Still very manner. Become coral some. One comes. Nothing ailment. How anger they will present their anger is very parents. Anything, any contradiction they get from outside, children will start just throw the pillow, they will throw the pencil, the box, the phone. Very audacious children, like break valuable things. They're very cursing, तो बर्बाद हो जाएगा and all that stuff. Restrict them from cursing and academia. Anger, very manipulative, shrieking. Okay. Let's these get easy. This is inconsequential. They get easily frightened, especially when they see the dog, and they start screaming with terror as if they're in a tiger. They're so frightened, you know. Whenever dog approaches him or sees the dog, they try to catch the dog. Terror by a dog must be. Some physical characters talk about in particular. They're chilly, they're fresh, they cannot stay in warm room. Whenever whenever they have cough, though they see, but it's better when they breathe with strong potion. When it is asthma, if the person is asthmatic, he'll next out of and take that. But again, he gets sick. Perspiration of chest very characteristic area. Emulated and the seat position, each position is this section. The called like you know, iode, and walking again, riding with head, the head is very periodic. It is the pain so intense. I with uh, the his head to the good side, she was a puberty, and she you know, never she attack his start on the floor, on the so intense with the blood, right? But what is in uh, 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 better aggravated by things, right? But I at that moment, you know, by very redness of face, but you hanging by character. Slight stuff. Again, this from in gas synthesis complete sulfur. Morning attack, persistent summer diarrhea like magnesium. Soon comes with great force. Same with simply. That is obviously tired, right? Flat action will cause tense fatigue in the stomach. Great aversion to work. There is a work can help with aggravated at night. Whenever having fever marks this symptom, the locality. They'll talk like like they talk about this, right? It will just keep like easy. Then see and again with change. It took music standing drive in time for walking from with. So any case of case of cough is I need lot of air and when we sleep is very sensitive. some, it comes very, very to the is Calcaria for urine anti creosote, camouflagina, chocolate. Now they all very active. Right? They all are very snappish. They throw tantrum. So how do you know what is the criteria for? This anti fine differentiation of in much. Try to just start with remedy creosote. So this creosote is a big difference. They are very much like a remedy tuberculum. Dissatisfaction. They will show things. What they get? Like mom, I want this phone. So they will ask for example, iPhone. I want this iPhone. You give there's a rule. These forbid them things which have asked will ask for this phone. Will play with this phone for 1 minute. Then they will pro with these what you go. But curiosity, the moment you will ask something when you so this tuberculum again the no creosote. There is education for itself. There is annual there is extra right? They are very things like music. Tuberculum enjoys music, curiosity, these again, T of C, curiosity are why the reason is because saliva coating. Not a very spot on the teeth of this. So we can remedy, right? Chamomile is again very stable, right? Angry, but the reason we sensitive people, right? Also, but irritability from but irritability from a lot of predisposition is very irritable. What they will do, they become very violent, very angry. What a violent and the remedy in comparison. Now, why SHELLY is so snappy? They are sensitive, very often. These children are very touchy. Very touchy, right? They offended. Even you look into the eyes. We have a grand they don't contact because they offended. In our children, they don't see eyes. But touching some sort of violence.
Madam, madam, there is a disturbance from your part. Your network is very poor.
Okay.
So, I think it is better to talk without the video. Is there any problem with your network?
No, I don't think so. There is any problem. I have a Wi-Fi connection.
Now we can hear, but there was your voice was breaking.
Okay, no problem.
There was so now it is clear.
Yeah. So next remedy is antim-crude. So again, Sina is very touchy, antim-crude remedy is very touchy. Both are very touchy remedies. Now how you differentiate? Because the antim-crude again is very irritable and complaining, like tuberculum. The difference is antim-crude remedy is very touchy, but they don't like to be looked at. Antim-crude child, when they will come to your clinic, they will not have eye contact with you. Even the mother will say, my child doesn't like being taken photograph. It doesn't like someone clicks with photos. This is anti-inclusive, right? But there is no violence. They don't attack anyone verbally. The whole anger goes into sulkiness. So they will not talk to the mother, talk to the father for 2 days. They become so sulky. Again, the students enjoy reading romantic books, or they're very sentimental and romantic children, right? They enjoy reading Mills and Boon. They like romantic songs. This is anti-inclusive. Chocolate, again, we all know, is wants a lot of love, affection, care. There's a lot of bitterness and sweetness. He always wants a hug. So again, a very deep remedy. Okay. Calcarea falls. Again, they look like it is so like tuberculinum. You know, it's one of the remedy which is very similar to tuberculinum. Now, what differentiates tuberculinum for calcarea falls? One, tuberculinum is not sensitive. It's not sympathetic remedy. Calcarea falls is very sympathetic, very sensitive, and they will always have anxiety for her loved ones, which comes from force. Also with that, they have a lot of desire for travel, but you don't find this sensitivityness, caring, affectionate remedy in tuberculinum. They are very sensitive to bad news. Okay, these are some of the differentiating remedies of tuberculinum, and this is how I think we are running up with time, and we will end our today's session with this remedy. And I have explained you some differentiating remedies for tuberculinum.
Yes,
Right?
thank you, Dr. Shelly.
Yes.
Unfortunately, the technical problems, we all know that we are also helpless. But fortunately, the last session, it was very clear. So very important session, and those who would like to participate, please raise your hand. The last point you mentioned is very important because the differential remedies. So I think it is only available in homeopathy to differentiate remedies on personal aspects. That is a personalized medicine. So Dr. Ram Parvesh raised hand, sir. You can unmute now. Please unmute and proceed. Yes.
Thank you, Dr. Shelly. Very nice presentation, but the technical problem sound not clear. Sound not clear. Technical problem. So, लेकिन pediatrics symptom observation very nice, excellent session. Right? Yeah, or your body language during presentation. Beautiful presentation. Body language बहुत अच्छा. ठीक है, धन्यवाद, धन्यवाद.
Yes, only a confident person can talk with such authenticity. That what we are really seeking for. Then
Yes, there is also some network problem with the Dr. Manoj, and as Dr. Manoj was pointing out about the differential diagnosis as just in allopathic profession, they need to differentiate the disease name rather than the symptom. As we homeopaths, we will have to differentiate between medicine. That is the differential diagnosis as far as homeopathic doctors are concerned. That means that we have to find out the disease, what it is. That is the first diagnosis, but that is not the end of the road for homeopath. But we have to move from there to find a simillimum. Then only we will be able to say which is the right and which is the exact remedy or exact simillimum for the patient. As you point out here, your medicine, the tuberculum, when you compare with all these medicines, are really important because tuberculum is a remedy that is being underused or abused or overused. This is what we have seen. Frankly speaking, whenever, in my experience, I must say, tuberculum, where usually when patients coming out with a recurrent respiratory attack, and out of that, they may develop a frequent fever sometimes, and
this thing, the problem with Dr. Tanish. He's changing, and changing, struggling, troubling everyone. So Dr. Salim Kumar is there. Yes, Dr. Salim Kumar. Yes, you can unmute now, Dr. Salim Kumar.
Sir, it will be very
Yes.
helpful if you repeat this class in another day.
Yes, I know I invite Dr. Salim Kumar to sit with.
Sir, it was very good class. It seems to be very good, but we can't hear it properly. So I think it is better she must have a repetition class of the same subject on in another day. IFPH has to give one more chance.
Definitely, she's Dr. Shelly is always with us, and Doctor has the ability to express what is what, and she will definitely make another presentation.
The same presentation. Of course, we are eagerly waiting for it.
Dr. Shelly, what's your opinion on that?
Same presentation. I mean, others will get bored. No, we'll see. We'll do it again. Or
No.
you can upload it. I'll come again with some other remedies and I'll show them same differentiations again.
Okay, that's good. That's good. Tomorrow
Or-
itself, we will be uploading the videos, but
Okay.
your slides are very clear, but the other things are not clear. That was the problem.
What she said was not clear.
You were expressing so much in your facial expression, but unfortunately, they couldn't clear. We couldn't hear exactly what you are telling. No, it was not your mistake, but it was the mistake of the system.
Yes, Dr. Shelly, how you compare with this AVR with this tuberculinum?
Which remedy?
AVR. There is a medicine from yes.
AVR.
Yes, tuberculin avis. I've never actually prescribed this remedy. I know the materia medica, so I will not give any comment which I have not prescribed. I've not got any case of avis. So what I don't do, I don't say. I just say from my practical experience. So I'm waiting for a case to come where I can prescribe this remedy. Even I'm working with bowel nosodes right now. So once we have cases, I'll be confident enough talking about it.
I think it's more powerful than tuberculinum in my observation. Dr. Tanesh, what is your opinion?
Dr. Sumana Kumari Pandey, madam, want to speak to you. Yes, madam, you can speak.
No, sir, nothing to say. The case description was too good, and discussion was also in a healthy manner. Good one.
What's your opinion on the presentation about the medicines she compared, Dr. compared? Yeah.
Really, sir, I couldn't say the whole 1 hour because due to some internet problem, might be with I'm in a different place in my clinics.
Okay.
So here might be due to network issue. I was not able to see about 40-45 minutes.
No problem. No problem. We can definitely we will be uploading the same tomorrow, so that you can watch the slides very clearly, and of course you can hear something out of it.
Yeah.
Dr. Hibbert wanted to say something. No.
Yes, you are busy in practice. That's the main problem. Majority of the doctors who are also attending this problem are doing double duty. Double complex disease, as just mentioned by Honeyman. One time, through 1 year, they are attending this. So
Finally, the comparative materia medica is one of the best thing for all the doctors to become super doctors, because if you are able to have a better knowledge with each remedy, when a patient enters into the clinic itself, you can identify that this is a tuberculin patient, this is a SINA patient, and this is a arsenic patient, like that. So knowing materia medica deeply, this kind of presentations will definitely help us to bring the best knowledge to all.
There is another reference in the Williamburg material. It says that before giving tuberculin, you must give this tuja.
Yes, yes, doctor, there is a question. What's your, it is stated that tuberculin should not be given in the to children who are having cardiac problems. What's your opinion on that, Dr. Shelly?
See, tuberculin is a very deep acting remedy. So when I was going through all literature, Dr. Kent, by Dr. Gunwante, by Dr. Chowdhury, they just said one thing: prescribe this remedy on totality. But unfortunately, many people don't prescribe on the basis of totality. Just for cold and cough, they will give tuberculin. And if that child is having cardiac issue, it can have a severe issue. So we have to be very careful whenever we prescribe doses, because they are very, very deep acting remedies. And we cannot just have a very superficial, non-constitutional approach. It will damage any case. But if the totality matches, miracle.
Yes, that's a good answer. Dr. Hilbert?
Sir, I had one question.
Yes.
Really, today I saw a case of 1 year baby, 1 year, 3 months with BHD and left to right shunt. So I went for the constitutional remedy. In that case, I went for Calicar. But what are the other drugs I have from experience? Can anyone suggest me that for VHD basing upon the pathology, can I go for any other drug? Now, I am not saying about the constitutional remedy, but basing upon the pathology, according to Bonning-Hussain view or Murphy from Murphy. So, can anyone suggest from Bogor's point of view, yeah, like that?
And Dr.
So-
Shelly, you have, you want to say anything?
Again, the same thing. There is no remedy for ventricular septal defect. We have the remedy for the constitution. So go to the best totality you can have. Take the mother's pregnancy history, because she developed ventricular septal defect. Just check in 3rd month and 2nd month what happened with the mother, because it is that month where that organ is developing, right? You have to just take a deep history of that month, connect with the child's history, give the constitution, because only that remedy will, stimulate body's own healing system. Rest all is very secondary. Nothing deeper than proper constitution remedy.
Exactly. This is what.
Okay. That means I have gone in that way only with the history during pregnancy. So with mother's psychology, already I have taken. So let me continue with that. What happens? Let's.
Yes, doctor. It is better to continue in the same way, and of course, you can give any other remedy when you feel it is a must. Otherwise, you just go ahead with your constitutional treatment now, and
Yes, I am going with that.
and let us see how the result come out, because you just started.
Let's see, after 6 months again we will go for echocardiography. So we will be able to know with that.
I think, and now I invited Dr. Abdul Salam Saab to say vote of thanks to the session.
Thank you, Dr. Danes.
Yes.
Good evening. Good evening.
Good evening.
On behalf of IFPH, I would like to thanks to Dr. Shelly and all audience. Thank you.